Welcome, everyone. I'm John Toole. I'm the Executive Director of the RFK National Resource Center for Juvenile Justice, and we are grateful you've joined us for the Dual Status Youth Reform Achieving the Possible webinar. I'm happy to announce we have more than 150 registrants for this session, representing 35 states across the United States. And we know your time is valuable, and we appreciate you making the time for this event. We'll be featuring my colleague, Jody Martin, Deputy Executive Director for the RFK National Resource Center, and three very special guests during our delivery of information, reflecting our experience, our perspectives, our guidance, our definitions, our methods, and practices that have resulted in a replicable roadmap for you to achieve the possible on behalf of dual status youth in your jurisdiction. I had the privilege of authoring the original and primordial framework to guide multi-system work on behalf of this challenging and vulnerable population of youth and families, while operationalizing the new Juvenile Justice Division, the Child Welfare League of America, in 2002, and originally supported through the Models for Change Foundation's Systems Reform and Juvenile Justice Initiative, MacArthur Foundation, I'm sorry. It's that framework that we'll feature today for you, which was prioritized as a primary focus of the RFK Center's work when we launched in 2013, emphasizing our unique technical assistance approach and meaningful partnerships with passionate and practitioners like you, and benefiting from application and lessons learned over 35 state and local jurisdictions nationwide over the past 20 plus years. It's also important to note that our experience has proven that innovative, measurable, and sustainable implementation is built upon the flexibility of this framework as distinguished from an often inflexible model. This tailored approach permits solutions to the cross-agency and system challenges presented by this work to be uniquely constructed in consideration of your localized contextual and environmental factors. What are those? They're statutory schemes unique to your jurisdiction. They're cross-agency or lack thereof, workforce status, philosophies, judicial leadership, budgets, prevalence of the target population of dual status youth, and resource accessibility, all of which may be unique to your jurisdiction. We believe it's ultimately the voice of those with whom we have partnered over the years that will most effectively communicate how they overcame the challenges of this cross-system work, many of whom I note from the registrant list are joining us today, and also comprise the membership of our Transformation of Youth Justice Practice Network, who frequently serves as mentors to those who want to take this work on to achieve the possible on behalf of dual status youth. During this webinar, you'll hear directly from two of those outstanding leaders, judges, overseeing sustained initiatives in the state of Ohio. Let's begin by providing a quick overview of the agenda. Jody Martin will provide definitional language supporting a clear understanding of the specific dual status youth target population for whom you may focus your efforts. The preeminent researcher, Gene Siegel, on this issue for more than 2 decades will offer his knowledge and perspectives on the research and prevalence of the dual status youth population. Jody and I will share duties to articulate the proven approaches that have achieved success as a result of your localized efforts and improved the outcomes, importantly, both human and fiscal, for this target population. Our distinguished judicial guests will highlight their work in Clark and Hancock counties in Ohio, capturing their key issues and important elements leading to their success. And then we have planned for a Q&A segment, whatever among your questions that remain unanswered at the conclusion of our time together for this event. We invite and encourage your direct outreach to us following the webinar. Our presenters today include yours truly and my partner, Deputy Executive Director Jody Martin with the RFK National Resource Center for Juvenile Justice, and the distinguished Gene Siegel, Senior Research Associate for the National Council of Juvenile and Family Court Judges, the Honorable Katrine Lancaster, Judge in Clark County, Ohio, and the Honorable Kristen K. Johnson, Judge in Hancock County, Ohio. Jody? Mute.
Thank you, John.
Yes.
Before I start talking about dual status youth and definitions, I want to just mention that if you do have a question during the presentation today, if you put that in the Q&A, then we will be able to respond to those. The chat is disabled, so please do use the Q&A feature. All right, as John mentioned, we wanted to start by providing definitions of dual status youth and specifically 3 subcategories. So who are dual status youth? Dual status youth is the overarching term to describe youth who come into contact with both the child welfare system and youth justice system and occupy various statuses in terms of their relationship to the 2 systems. So in other words, dual status youth is any youth who's come into contact with both the child welfare and youth justice systems to any degree, in any order, and at any time. As we work with jurisdictions to identify specific target populations, it's helpful to define 3 subcategories of dual status youth. Dually identified youth are currently involved with the youth justice system and have a history in the child welfare system, but no current involvement. Dually involved youth have concurrent involvement, which could include diversion, informal, formal, or a combination, with both the child welfare and youth justice systems. And dually adjudicated youth who are concurrently adjudicated in both child welfare and youth justice systems, meaning both dependent and delinquent. Looking at historical and current data scans can help jurisdictions to identify which of these subcategories of youth to focus their policy and procedural activities. They also assist multi-system collaborations in developing policies, procedures, and protocols that improve youth and family outcomes. Through our experience in partnership with state and local jurisdictions, we've recognized the importance and value of these definitions to guide, drive, and inform critical policy and practice reforms. Now I'll hand it over to Jean Siegel to explore the research and prevalence of dual status youth.
Good morning, everyone, and good afternoon to some of you. We have a short amount of time, and very briefly, let me just comment that I'm honored that the first segment that we're going to present here involves data and research. From a researcher perspective, there is nothing more exciting, of course, than talking about data and research at this point in time. So I hope you all hang in with me as I fly through a lot of information. I'm going to briefly discuss the growing body of research that shows that dual status youth have significantly more adverse trajectories in the general delinquency population, that in terms of prevalence, there are often more dual status youth than we think in our own jurisdictions, that Black youth and females continue to represent disproportionately higher segments of the dual status youth population, and that dual status youth are generally more likely to more deeply penetrate the juvenile justice system and stay in the system longer than their general delinquency population counterparts. Next slide, please. Oops. Let's go back. There you go. Thank you. All right. This slide just kind of gives you a compilation of research findings reflecting the adverse impacts of child maltreatment on subsequent delinquency. Basically, this research actually goes back to the 1980s when the links between child abuse and neglect and criminality were first explored. As you can see in this graph, we can see that overall, kids with such histories exhibit a very high, almost 60% likelihood of exhibiting delinquent behavior. Next slide. But it's not just that dual status kids have high levels of delinquent behavior. It's also important to note that these kids begin their delinquency careers earlier and experience detention at earlier ages, more frequently, and for longer lengths of stay than the general delinquency population. Our prior research in Arizona, Washington State, and Nevada, for example, as well as other research, have repeatedly made these findings. We also know from prior research that youth referred to the juvenile justice system at younger ages are substantially more likely to experience subsequent referrals. And it's not just their age that matters. These kids often present a complex range of traumatic experiences and behavior problems that prompt further system involvement. Next slide, please. Okay, as I mentioned, research has also shown us that Black youth who experience both systems also experience more adverse trajectories than other youth, including higher rates of deeper system involvement. That can include commitments to youth corrections, for example, and that girls appear in duly involved youth populations at substantially higher rates than the general delinquency population. Now, more specifically, girls, for example, they generally represent about 25 to 35% of the general delinquency population in most jurisdictions as well as nationally. But it is not uncommon to see upwards of 45% or more in the duly involved youth population. Next slide, please. Again, repeated research shows that depending on how one counts or calculates duly involved youth or those other subcategories that Jody mentioned, the prevalence in the juvenile justice system population can often exceed 50%. Okay, next slide. Looking next at research in some specific jurisdictions, our previous research in King County, which is the Seattle, Washington area going back to 2011, found that almost 2/3 of youth with delinquency referrals to the juvenile court had past or current child welfare system involvement. And just very quickly, I can tell you when we made that finding, it was astonishing, the reaction from, for example, the juvenile court directors and judges who really didn't think the prevalence was that high, but indeed it was. Next slide. Okay, in Los Angeles County, an estimated 80% of youth exiting from their intensive probation program had a history of being referred to child protection services, with many experiencing referrals beginning in early childhood. Interestingly, in Los Angeles, the juvenile court there has operated a specialized dual status youth juvenile court docket for a number of years. And this represents one attempt for the court itself to consolidate or combine delinquency and dependency matters before one judge so that these cases do not fragment into divergent paths. There are other courts around the country that have consolidated these cases as well. Next slide. Okay, looking at prevalence in a couple of more states, in Massachusetts, almost 75% of youth committed to the state's corrections department had prior involvement with the child welfare system. And looking more broadly at Washington state, approximately 44% of youth referred to the juvenile justice system had a history of involvement with child welfare. In other words, once again, the numbers or percentages of such cases often exceeds what one may think, depending on how a jurisdiction defines and counts duly involved youth. And just to wrap things up, it's important also to keep in mind that it's not just the adverse trajectories and challenges that are posed by these cases, but also the negative impacts that these cases can have on court dockets, placement costs and placement disruptions, workload pressures, and other effects. Yet, as you're going to hear in a few moments, there are things that can be done to positively impact these dynamics. Thanks for your attention. Look forward to your questions and discussion. John?
Gene, thank you. Thank you for your wisdom, your knowledge, your information, but mostly for the past 2 decades, you and your colleagues like Greg Halemba and Hunter Hurst and others, your tremendous passion for focusing attention here. And your points are well taken, Gene. Often when we walk into a jurisdiction or scan an audience during trainings or presentations, we ask, what do you think the percentage of youth are that may experience dual status on any one of the definitions that Jody articulated? And it's often far less than what the actual percentage is. And we all know, as we come into this webinar event, that these are the youth that experience remarkably complex challenges in multiple arenas, in their behavioral health and education, in their families. And it's just imperative that we find more effective ways of building the multi-system collaboration to impact these youth. So thank you for raising that research, for continuing your passion and sharing this with us. I'm certain there will be some questions for you at the end of this that help you articulate with even greater clarity some of the research and data that you're so familiar with. Folks, the independent operations of the health, behavioral health, child welfare, education, youth justice systems have too frequently discouraged the collaboration, the coordination, and integration of care and services for dual status youth. Whether reflected in, and I hope this will resonate with everybody on the webinar, differing agency philosophies, different mandates, different job responsibilities or descriptions, or statutory, regulatory, or policy conflicts across agencies, whether they're perceived or actual, incompatible case management and or data collection and reporting systems, or access to funding allocations for services or programs. The challenges are considerable. Were they easier to overcome, we probably would have a greater volume of examples of success. But our straightforward four-phase process, which is detailed in our dual status youth technical assistance workbook and our published article in Juvenile Justice Update, published as recently as January 2024, in our ongoing effort to support your ability to overcome these challenges, provides that roadmap for your consideration and application. Indeed, it's a roadmap. It's not a prescription, because localized solutions are what we're going to hear about today and are what normally carry the day on behalf of these dual status youth population. The four-phase framework, simply an overview of that. Phase one is mobilization and advocacy. This is really about the leadership bringing together collaboration from all the affected and impacted agencies and community partners. And this includes the youth and the family and those with lived experience in our system responses. It actually may include for us, if we're partnering with you, a collaborative planning session to help successfully build that cross-system team that will lead, that will drive, that will inform, that will allow or permit progress to be made across multiple agencies. But central to the success, we believe, is a localized examination and analysis of policy, procedure, and protocol, where experts from localized systems can provide their examination of the data and the data systems that inform this work, their review of existing policies, procedures, and protocols across multiple agencies, and a legal analysis, imperative in this work, to look at law, court rules, policy, statutory schemes that either enable or currently disable this kind of cross-system work. With that localized analysis, the leadership team can drive in phase three a specific action strategy for that local jurisdiction that creates policies, procedures, that identifies tasks and timelines, and the written documentation that will allow fidelity to the innovative ideas and solutions that are created in that local jurisdiction. And then the RFK National Resource Center has been for a long time deeply committed to implementation science, change management, whatever you want to call it, the research that helps ensure that an infrastructure can be built to adopt, to implement, and then to sustain, measure, and replicate the fidelity of practice that you have created so that every dual status youth gets the benefit of the innovative ideas and solutions that you have produced. Throughout all four phases, our unique and unparalleled partnership approach involves hand-in-hand technical assistance, coaching, mentoring, facilitation, guidance, mediation, and indeed in many jurisdictions where we'd rather be under the table than at, conflict resolution to get to the solutions that will benefit these youth. Emerging from our historical experience and reinforced by our current work in Las Vegas, Nevada, in Santa Clara, California, and in the last 2 weeks, we visited both of these groups with our ongoing support, including the co-located DIY unit in Santa Clara, California, made up of some extraordinary professionals, and the 4 counties in Ohio. It's clear that success is predicated on the establishment and policy and operations of the following core practices. You can read them. I want to highlight them very quickly. It is critical that once we identify a target population, we also identify those dual status youth for special attention early and with fidelity. It's critical that we agree in a cross-system manner on a set of sought outcomes for our dual status youth target population. And we know those outcomes so that we can design the activities, the practices, the operations for those youth to achieve those specific outcomes. Part of our principles in our center's operations is the commitment to use of validated screening and assessment instruments in decision-making, but we're talking about the use of whatever exists in an IEP evaluation, in a clinical evaluation, in a risk-need responsibility, in a safety assessment, and bring that information together to develop a good collaborative decision-making process plan for those youth. Emphasis on alternatives to formal processing at the earliest opportunity and all key decision points. Gene's research on how quickly these youth enter and have a deeper trajectory into both systems is critical for this particular point to be supported. We've mentioned, not as a sidebar, but as a critical component, the engagement of families and or caregivers and pro-social familial and community supports for these youth must have a positive opportunity to create a positive self-identity for them moving forward. The convening of a multidisciplinary team process, by whatever acronym, by whatever practice in your jurisdiction that is used to convene multidisciplinary teams to bring together relevant and necessary information that supports an effective intervention or often an effective crisis plan. And then the coordination of case planning, the court process, which is critical to the implementation of our policies and procedures, and then subsequent case management and the coordination to achieve the shared mandates of multi-system partners. When adding the all-important element, Jean will love me for this, but it's fundamental, of creating a methodology for data collection, management, and reporting to assess the fidelity of our designed process and the impact on the youth, jurisdictions are increasingly achieving the possible. In fact, it's our current efforts in Las Vegas and Ohio that have contributed to our ability to develop two new and unique resources for our toolkit at the National Resource Center that will support you and your work in the future. And it will include a data collection and management protocol manual. And I got to give shout outs to Mr. Bob Swisher, the data analyst in Clark County, Ohio, for developing this. He's been fantastic in our assistance in Clark County. And an evaluability assessment, which Gene Siegel and Dr. Kristen Russell are working on with us in Las Vegas, Nevada, that can be used across jurisdictions that take on this work. We anticipate availability of these resources by July of this year.
So recognizing the challenges that John spoke to related to conflicting mandates among agencies, many jurisdictions we've partnered with have committed to 3 important fundamental approaches that have contributed to successful collaborations and positive outcomes for dual status youth. First, it's critical to understand and embrace the research findings and implications of adolescent brain science. We know that adolescents differ from adults in 3 important ways. Adolescents are less able to regulate their own behavior in emotionally charged contexts. Adolescents are more sensitive to external influences such as the presence of peers and the immediacy of rewards. And adolescents are less able to make informed decisions that require the consideration of the long term. These adolescent characteristics have provided the foundation for adoption and implementation of developmentally informed practices, policies, and procedures that have proven effective in achieving the primary responsibilities of the youth, justice, and child welfare system collaborations. Second, embrace the positive youth development approach. This approach focuses on nurturing the strengths and potential of young people, rather than just addressing problems or risks. It emphasizes creating supportive environments, fostering positive relationships, and providing opportunities for youth to develop skills, confidence, and a sense of purpose. Ultimately, it aims to empower young people to thrive and contribute positively to their communities. As Jean shared, dual status youth more often experience complex trauma. This fact calls for a commitment to a comprehensive behavioral screening and assessment methodology that includes application of scientifically validated use of trauma screening for all dual status youth. Given the impact of active trauma symptoms in rendering services and programming ineffective, this collaborative commitment to understanding methods to address these active symptoms will provide an increased likelihood for success in ameliorating risk and stabilizing behavioral health for dual status youth. By following the core practices that John outlined and committing to the 3 fundamental approaches, jurisdictions have realized numerous positive outcomes for dual status youth. It's important for collaboratives to agree on a set of sought goals and outcomes based on the characteristics within their jurisdiction. Many collaboratives have identified and improved outcomes in the following areas: prevent further involvement in the child welfare and youth justice systems. This may include successfully completing probation or reducing recidivism, improving overall family functioning, stability in living situation, which could mean youth will experience placement in a safe and stable home, stability in behavioral health, stability in education, such as youth will have stable enrollment in school and youth will increasingly engage in their education. Other outcomes have included increased community and cultural connection, such as youth will experience opportunities to understand their cultural history and background, and youth will have meaningful relationships within their community. And last, improved social and emotional health and well-being, which may include youth are engaged in pro-social activities and or employed. And youth will develop and sustain strong supportive relationships with natural supports. The specific youth outcomes identified by the collaborative become the focus of ongoing data collection and reporting to assess the effectiveness of the efforts. The framework, research, core practices, and fundamental approaches that we've shared are foundational pillars of success for every state and local jurisdiction. This map highlights jurisdictions who have or are currently partnering with us to engage in a dual status youth reform initiative.
Thank you, Jody. We have but an hour with you. We hope we're laying out a framework, a fundamental approach, some core practices that will lead to your success. We believe you're on this webinar because you are a committed professional who is seeking solutions for some of the most challenging youth and families in your jurisdiction. Jody and I are deeply passionate about this work. We have a combined 40+ years of actual practitioner work in local juvenile justice systems, and we've had our share of experience with these dual status youth population. For me, I can attest to some unsuccessful ventures that ultimately led to the demise of several youth that I had been associated with professionally. We want to facilitate your passion, facilitate your understanding and knowledge of how you in your jurisdiction can make a difference moving forward. We think that these core practices will enable your success. And with gratitude to the Ohio Supreme Court, Children and Family Services Division, and their advisory committee members, 4 counties, Champaign, Clark, Fairfield, and Hancock in Ohio, have partnered with us over the past 4 years to produce a strong commitment to a cross-system collaboration that's produced replicable policies and procedures to achieve the possible. Just fundamentally, they have worked to use data to help them identify their selected target population. They have indeed assessed the legal assets through active participation of prosecuting and defense attorneys and the challenges they face, like information disclosures and lawful execution of informed releases. They have developed these intricate set of policies and procedures for cross-system implementation, and they've developed multi-system training to ensure all the parties who will practice this work will practice it with fidelity. And finally, they've developed cross-system data collection methodologies. We are thrilled to welcome impressive judicial leadership from Clark and Hancock counties, respectively, to share their experiences with you. First, let me introduce Judge Katrine Lancaster from Clark County, Ohio, to share her experiences. Judge, thank you for sharing with us.
Yeah, and good morning. And to those of you who are having morning, and afternoon to those of you who are in jurisdictions that are in the afternoon. I thought I would start with who we are in Clark County so you have a perspective of our demographics. So we're located in the southwest quadrant. We're truly a mix of rural and urban. Half our population is living out in the county. The other half is living in our county seat of Springfield. You can see the population size in 2022. That is actually increased. We have a growing Haitian population that we've been told as many as 10,000 have come into community. Just a very elusive figure at this point, but we're certainly seeing those populations hitting our systems now. Not yet our dual status youth. So just I would note that we're not seeing them yet into that system. 80% of our juvenile justice and child welfare cases are residents of Springfield. And I think most importantly to look at is that almost 40% of the kids who are residing in the Springfield City School District live in poverty. And that brings in obviously a whole host of challenges for us in managing those youth and their families. And next slide. So as it relates to collaboration, we began our dual status youth initiative and did our launch October 1st. I should say we did our launch October 1st of 2020. Now, we were one of 2 counties that received the technical assistance grant and had been receiving assistance from the RFK Community Alliance and under the guidance of John Toole and Bob Birmingham. We had a lot of conversation before that launch. We really were challenged on the why, because we had a over youth identification process in place, though no intentional programming with it. We also were trying to determine the target population, fair amount of discussion there, and finally got down to writing out our program narrative and working through the legalities, the releases of information, how to receive information from cross agencies, and then how we were going to look at data points and outcomes. So I think as we move, and you can see who our community partners are that we identified in the beginning and on the onset, and those were the folks who were at the table in the beginning. One that we did not add in here, we did have law enforcement initially. I think they came to our first meeting, and ultimately there was not as much of a need for them to be a part of the discussion, so they dropped off fairly quickly. So I would note to all of you who are interested in moving an initiative forward in this manner is to really look at your data. So as I said, we had some form of crossover youth and really trying to get the community partners to buy into the initiative and move things forward was to look at the data. So similar to what Jean had shown previously on the slides as to how many youth are in both systems, we decided let's take a look at youth who received new charges in 1 month here at the juvenile court. And then we gave that list over to our child welfare folks. They took a look to examine whether or not there had been any involvement with that youth in the child welfare system, and 90% of those youth had some involvement at some point in their life. And so that was really for our point, okay, now it's time to have some real conversations, as clearly is concerning. So we then were able to move forward, and we looked at then I moved some of my slides around here, so I'm just in terms of talking points. So when we looked at then moving forward, and that really is what engaged the initiative. If you could move to the next slide then. So I think that it's important when you're moving forward to have a champion. So somebody in one of your agencies really needs to be there and advocating. And in our area, it is our duly involved youth probation officer. She works with the youth and family right from the beginning of identification. We are challenged a little bit here in this community in working with our partners on the child welfare side, only to the extent that the social worker is going to be different in each case. So that movement of trying to have both of those partners working together at the same time with the family, which was our initial discussion, did not come to fruition in the way that we'd like to see, and we're continuing to work on that particular concern. The other piece on collaboration is really being committed to returning to the table. So one of the things that comes up are problems with communication. There are concerns that maybe we're not moving forward on the resources that are there, and we need to get better resources, or the discussion needs to be had as to the population. We had originally had truancy included in as part of our population with charges, and determined that that group was just too big, and it was growing our DIY population larger than what we could manage and had staffing for. So we did end up excluding it. So we note a commitment to returning to the table. And then reviewing the potential community partners. As we've moved forward, we recognize we do not have a strong voice of youth and family at the executive level. So those with lived experience are really going to be able to tell you what the needs are and what their experience is. That's something that we know we're missing. As we move forward, we're also looking at including more involvement with mental health services as well as education. Both are at the table, but not as strong voices as we'd like to see. And we see those as being strong partners in helping manage success of the youth and family. Our resources here in community, unfortunately, are limited. So we are going to have to think outside our boxes. And how do we access that? Have the collaboration with those and organizations that provide the intervention, some of the interventions, so mental health services, pro-social activities. How can we get to them more quickly? Make sure that we're collaborating with them and assisting them in understanding why it's important to move things more quickly with this population than other populations. And next slide. So leadership, the judges do have the power of the robe to bring people to the table to have the conversation. So I can say when I took the bench in 2019 and then in 2020 asked people to come to the table to have the discussion, as I said, there was a little bit of, this grumbling of why do we want to do this until we pulled the data together. But I was able to bring them to the table because of my position. I think it's important to note, though, that the juvenile court judge is also a common denominator. So I see the kids in the juvenile justice system, and I see the child welfare cases, and I understand that those systems have sometimes very different procedures that they're looking at, different outcomes that they may be looking for. And so the judge is able to really look at both those systems and hopefully bridge some of that conversation. The role of the social worker, role of probation officer can be challenging in both areas, but then to work together to help to help the youth and family move forward and find the right interventions to come up with solutions and move things forward is important. The judge is uniquely situated to do that, at least in Ohio. So next slide. So the process of identifying our target population, this was our lengthiest discussion. And I've just talked to you about the judicial leadership. This is, in my opinion, where the judge should probably take the back seat, because I was interested in having this target population much larger than what others who were involved in our discussion. So I took a back seat to that discussion and recognized I would note for those judges out there, take your back seat and listen to your community partners. They'll have a better feel for how many youth they're going to be able to manage. So we did decide to go forward with the dually involved youth, and we have 2 pathways into our program. So those youth who come into our system with juvenile justice charges will then notify our child welfare area, and they will get back to us. Usually it's within the same day as to whether or not there's an open case in the child welfare system. So that's pathway 1. Pathway 2 is that if the child has received charges in juvenile justice and the child welfare system has a case that opens up within 30 days of the charge coming into the juvenile justice system, that's our pathway 2. We have far more youth coming in on pathway 1 than we do on pathway 2. We had specific exclusions, and we have yet to have a serious violent offender or a sex offender, both that we were looking to evaluate. We've had ongoing discussions, but at this time, the serious violent offenders are really being managed with different programming. So we have not included them in our target population. Our sex offender, we were going to move on a case by case, but we ended up developing some programming for that specific population. We saw, sadly, an explosion of sex offenses coming into our system, such that we had a probation officer who's designated just to our sex offense cases and manages from start to finish, and works with the social worker in cases where they have a open children's services case. So I would note, our identification is probably one of our strongest pieces of our duly involved youth initiative. We move very quickly and we're meeting those timeframes. If it's not within that business day, it's the next day. So it's usually within hours if the youth is detained that we can figure that out. And next slide. So the development of the process, we had, as I said, we did a great job of identifying the youth as quickly as possible. And I think that's a critical point that all are likely to make as critical points here. We do that well, and I would encourage those that are beginning the program to figure out how to best information share so that you can identify those youth quickly. As soon as you have identified, you can start moving in with the conversation and getting your folks engaged with the youth and family. Information sharing between juvenile court and family and children's services. This is also very important, and we've been a bit challenged with this, and to the extent that some of the data pieces that we'd like to see from the child welfare area are confidential in Ohio. I'm sure that's true throughout the United States by federal law. And however, it's very challenging when we need information on the juvenile justice side to look at some of the data points. So we had previously been able to receive that information because our data analyst worked for Job and Family Services. I created the problem because I hired him on as our data analyst. We're struggling with that now. We do receive releases of information, and so we're able to have conversation, and that is helpful. Family engagement should be a collaborative effort between all the agencies involved, and that there's constant communication. This is where our multidisciplinary team approach, I think that has been a very easy thing for us to implement here because we had family stability meetings that occurred several times a week. And so 2 of those meetings are designated just for this population. The multidisciplinary team that does meet with juvenile justice, child welfare, and then we have other community partners at the table that include mental health, that include DD services if needed. The welfare department, I believe, is there as well to assist if there's any benefits that are needed.
Hey,
so,
Judge, if I might, do you mind skipping to the last slide?
Sure.
We're a little bit pressed on time.
Okay, absolutely. So youth characteristics to go through very quickly here. Our average age of our youth is 15 years. White males make up the largest portion of our population. You can see there. Most of our charges come in as misdemeanors. We would note that other than the unrulies that I spoke of earlier on the truancy, that assaults would be our next largest number of offenses that we see our duly involved youth coming in at. We have minimal data as it relates to child welfare due to the staffing changes I explained. And 21% of the new offenses while in the program were misdemeanor 1 offenses. Our recidivism rate is at 25%. I think that's what I'd like to highlight there, 25%. And that is about the same as the recidivism rates for our recidivism rates for youth where you're looking at the population of ODYS's stats on recidivism. So they're trending at about the same rate, which is showing us that we are seeing success in that they're looking very similar despite their challenges of having family stability issues. They're trending in a similar direction as to the other youth in other programming.
Judge, thank you so much. And the last point is critically important. You are having success. You do have data that reflects some of that success. And the collaboration has been strong for 4 years while confronting the usual challenges of keeping a collaboration together. And it's your leadership that has been primary in keeping that leadership together. Thank you. I'd now like to introduce Judge Kristen K. Johnson from Hancock County, Ohio. We've been privileged to work with her as well and her colleagues, and she has some information to share with you about their challenges and, most importantly, their successes. Judge?
Thank you, John, and thank you everyone for attending. I think this is a great topic to talk about, a topic near and dear to my heart. I know Judge Lancaster had some great information for you, so I think what I'm going to do is probably talk about what's a little bit different in Hancock County from what she's laid out. Our demographics are rather similar to her. She has a little bit more of an urban area than I do. We are much more rural. We do have a city of about 48,000 in the center of our county. Our county is 78,000, so we're smaller than her county. And with a smaller county comes good and bad, right? We can wrap our hands around the numbers a little bit easier, but we have less resources than a larger county might have. We started at the same time with the grant from the Ohio Supreme Court. So I want to thank them. We wouldn't be here without them bringing this to us. And I happened to be at the presentation with the director of our Children's Services Agency, and we kind of looked at each other and went, hey, this might work. And it has. To give you I don't want to give away the ending, but this is a great program. I want to talk about the collaboration. Our team looks almost identical to Judge Lancaster's team. We have added a couple others. We've added our court-appointed special advocates, our CASAs, to our team. They've been invaluable. They go out with children's services to the home, which is information that you just can't get unless you're seeing them in their home. We've added our mental health agency. We have one major one. We have several other smaller, but the major one is at the table, Family Resource Center, and they provided a mobile response stabilization service to the team. So that's very helpful. And our police officer, law enforcement agencies have remained at our in our team throughout, and it'll make sense why they stayed in mine and did not stay in Judge Lancaster's. So with the collaboration, I also want to stress exactly what Judge Lancaster said. The leadership of the judge, I think, is very imperative. I think that you need to step in, and even though you might feel uncomfortable, get everybody around the table, because they're going to say yes to you, or they won't say yes to everybody else. But when you're talking about different things, I think it's really interesting how I saw the team act when I stepped back and I let them bring out what they thought was important and then back them up in that. And I think a lot of the time the team members feel not heard, especially a children's services agency, where they feel like, nobody understands what we do. Nobody, understands our requirements. And I have a history. I've represented children's services in my past life for 12 years. I know what their requirements are. So as we were going through and hearing that, I'm concerned with them meeting their requirements and not having to violate anything that their requirements limit for them. So I think that brought a little bit of a flavor to the team where, okay, now they feel like they're all on the same level. In the end, somebody needs to make the decision. That always ends up to be me. But along the process, I think it's invaluable to have them see that I'm stepping back and I'm talking to them about, what do they see? As we were talking about our target population, that is, I think, one of the most interesting conversations, because it went on for an extended period of time. And who do we start with? And I saw one of the questions in the chat, why leave some people out and why not include everybody? I think it's important that you start not super small, but small enough that you can get your hands around the population, so you can work out all the bugs and the details, and then perhaps talk about, could we take a little bit of what we're learning here and move it on and use it in different places. So our program is called Safety, Systemic Approach for Engaging Targeted Youth. What we decided for our target population were kids who were charged with domestic violence. Domestic violence charges are the #1 reason kids were locked up in detention for a number of days. And so we thought, okay, let's start there. And then we were seeing a trend in Hancock County, and maybe you are in your jurisdictions, that I'd have the detention hearing the next day, and the family would come in and say, Judge, I'm done. I don't want this kid back. I've had enough. We've tried everything. And I frequently had not seen them before. This is their first contact with me. They would be 12, 13. And they said, we've been dealing with this for years and nobody helps us. And several family members walked away. And I thought, oh. So as we were talking about a population, very quickly, this population came to mind for everybody because Children's Services ended up with them in foster care. We had a very difficult time with the children, as you might imagine, and very low success in reunification. So we started with this population. And instead of having the kids go to detention in the middle of the night, they have to call me. I don't have my own detention center. Detention centers in the next county over. I have to authorize that. That's why law enforcement was on board. We talked to them and I said, what about if we put them in respite, put them in foster care instead? Then we don't have that detention hearing requirement. Then everybody's not on this whole, I got to get this done. I got to, and it just kind of eased everything. Now, I will tell you that law enforcement still has the ability to call me and say, nope, this one I think needs to go to detention, judge. This was a bad case, but we still do the safety program with them. So before we have a detention hearing, or even if they go to respite, the very next day we have a team meeting with a family, and the family sits around the table and services are offered. Our local agency gets out there with the MRSS program. CASA gets in the home within that first week, and we start services intensively. I know we're getting short on time, John, so I'm going to jump to, if you could go to the next slide, I want to give you where we're at. So far, we've had 59 kids through our program. 73% of those children that have gone through the program and successfully completed it are safely back in their homes. So that's a pretty good stat right there when you think about 73%. The ones that don't successfully complete it have their charges formalized and go through the typical, what you would imagine, process through juvenile court. Only 2 of the kids that have successfully completed the program have committed another offense. And only 1 family has refused the program and walked away from their child, which I think is worth every effort that we could ever have put forth here. We also have reduced numbers of days in detention. Children's Services has reduced caseloads. Even I pay for that respite program through a grant that I have through our prison system. They give me a grant every year, and I use that money for this program and pay for the respite program that way. And I will tell you that I have law enforcement calling me in the middle of the night before I can even ask, can this kid go to respite? They're saying, Judge, I want this kid to go to respite. I think that's the appropriate place for them. So hopefully I got you a little bit back farther on track, John. Happy to answer any questions.
Thank you, Judge. I want to answer one question that we've seen come up. And that's just real quickly, I can answer that. It's regarding the cycle of violence. I'm missing where that's coming in right now. Where is that? Missing it, maybe answered, sorry. The notion of the cycle of violence with parents. Back in 2003, based on 35 years of research conducted by Kathy Spatz-Whittam, a colleague of mine who joined me when we first started this work, Janet Weig, and I partnered with Kathy Spatz-Whittam to publish the Understanding Child Maltreatment and Its Relationship to Delinquency, the Cycle of Violence. It was published 21 years ago. It remains true today that your question about the impact of that cycle of violence, that they were dual status youth who are now parents, that was evident. And now for 50 years. And we have to break that cycle of violence by these kinds of interventions. Even Judge Johnson's population that she's speaking to is often a cycle of violence that she's witnessing, and the incredibly successful efforts that she's experiencing are breaking that cycle of violence. So thanks for that question. I appreciate that. There have been a couple of others come in, and I think Gene Siegel is answering the question to Judge Jeffrey Gaither, who has been a champion in the state of Indiana. He is on the call with us. I applaud his leadership, his efforts, the Honorable Judge Jeffrey Gaither, and appreciate the question that you're asking. I do have one other question, because Judge Johnson, in a little bit more detail in the moments that we have left, can you talk about how you develop this viable respite care option? We frequently hear we don't have resources for this population, so even if we identify them, we can't do anything about it. You did something about that. Can you, and I apologize, maybe in a minute or less, tell us how you did that, Judge?
Well, when we started talking about, what is another option? How do we handle this? And we just thought that the detention in the middle of the night was not the answer. We contacted a couple agencies and said, would you be willing? And so we have a family who agreed to take these kids. They have always taken teenagers, difficult teenagers, so it's kind of their expertise, and I pay for a bed. So I have an open bed there at any time. We haven't had yet the issue where we have two at the same time. So we'll see what happens when that happens. But that's what we do, and I use that grant to pay for that.
Awesome. It was a solution. It was a solution often in an environment where it says, well, we can't do anything about it. And it's that kind of innovative thinking that is so much demonstrates your success, Judge Lancaster's leadership and their success, and so many other people whose names I recognize that are on this webinar who have similarly led these kinds of identification of innovative solutions in their local jurisdiction. I have one other quick question, and it's to Jean. Jean, you spoke about the rapid trajectory of these youth deeper into the youth justice system, and often the research speaks all the way into the criminal justice system. Again, almost unfair, but maybe in a minute, can you at least highlight that research and what that tells us about this population?
Right. What we found in Arizona, for example, is that one of the key factors in why you want things to happen in such a timely fashion with these cases, and you're hearing it from both the judges, is that if the system takes its time, particularly if kids are not detained, if they're not detained, unfortunately, these kids get in trouble again. So one of the findings in our Arizona, what we call the Arizona Dual Jurisdiction Study, as well as our examination of non-detained youth in Arizona, many of whom were duly involved, what we found was these youth reoffended or got new referrals in significantly less time than youth in the general delinquency population. So the systemic response, the provision of services, all of those things, which would include, of course, assembling your MDTs and mobilizing, need to happen much more rapidly than with the general delinquency population.
Man, Gene, I really appreciate that answer. And hopefully that sticks with our participants today on the critical nature, after the collaboration is formed, of developing this kind of rapid response to mobilize the comprehensive nature of services and interventions that are needed for these youth and these families. We are almost at the top of the hour. We only ask for an hour of your time. If I may, next slide, Jody. I believe that's our contact information. I just want to close with this. Jody and I want to offer a special thanks to all of you for your continuing passion and commitment to youth, families, and your community that's demonstrated through your often thankless efforts. We want to express our gratitude for our special guests today who have given us all more information, perspectives, experience, and the accomplishments that we might build upon. We have to believe we can succeed. We have evidence that we have, and we know that you could produce future leadership opportunities to succeed on this challenging and vulnerable population. We hope that you'll reach out to us, permit us the privilege of supporting your current or future efforts through training, technical assistance, connections to our Transformation Youth Justice Practice Network, members or mentors, or other innovative leaders who may have overcome the very challenges you face in achieving the possible for dual status youth. Thank you all very much.